Hey there. As parents, it's totally normal to have questions about our child's development. We're always wondering about the unique way they see and experience things. So today, we're going to talk about what it means for a child to be on the autism spectrum. The goal here is just to bring some clarity and maybe some peace of mind. Maybe this is the exact question that's been on your mind. It's a thought that comes from a place of deep love, from wanting to connect with and understand your child on their terms. In the next few minutes, we're going to explore this together and hopefully turn that wondering into understanding. Okay, let's start with this because it is so important. This is the whole idea we need to keep in mind. An evaluation, it's never, ever about putting a child in a box. It's about finding the right keys to unlock their potential, to help them learn, grow, and just thrive. All right, so let's dive in. What exactly is autism spectrum disorder? You'll hear it called ASD a lot. Let's define it. So at its core, ASD is a neurodevelopmental condition. And really, all that means is that it's about the brain's unique wiring. It just develops a little differently, and that affects some of the fundamental ways a child learns to communicate, connect with others, and really just make sense of the world around them. We can kind of break this down into four main areas. First, you've got social interaction, how a child connects with people. Then there's communication, and that's both verbal, what they say, and nonverbal, like body language. Play is another big one, especially that imaginative, make-believe kind of play. And finally, sensory stuff, how a child experiences sights, sounds, and touch, which can really shape their behavior. So what does this actually look like day to day? Well, you might notice a child who avoids eye contact or doesn't seem that interested in playing with other kids. Sometimes they might repeat words or phrases they've heard. That's called echolalia. Or maybe they really need a routine to feel secure, and changes are super stressful. And you might see this incredible, intense focus on one particular thing, like trains or dinosaurs. These are just a few of the ways it can show up. And this right here, this is the most crucial part. There's no one look for autism. That word spectrum is everything. It means every single child with ASD has their own unique mix of amazing strengths and real challenges. That's why a one-size-fits-all approach just doesn't work. Okay, so we've got the basics down. Now for the practical part. When might be a good time to think about chatting with a professional? Here are a few developmental guideposts to keep in mind. For example, somewhere between 12 and 18 months, babies usually start pointing at stuff, right? Like, hey, look at that. They're sharing an experience with you. If you're noticing delays and things like that, or you see some of the other behaviors we've talked about, just checking in with a specialist is a really great, no-pressure next step to get some more info. And please remember this. You do not need to be 100% certain, not even close. Trust your gut. You're the parent. Seeking an evaluation is just about gathering information, and we know for a fact that the earlier a child gets the right kind of support, the better things go for them down the road. So if you decide to take that step, what does it actually look like? The whole idea of an assessment can feel pretty intimidating, I know. But really, it's just a structured way to get a clearer picture of your child's unique world. Think of it like a 5-step roadmap. It all starts with your story, because you are the world's leading expert on your child. Then, specialists use some structured interviews and tools to get the full picture. But honestly, the heart of it is often just watching your child play. That's it. And after all that, all the information is pulled together to give you clear feedback and a plan for what to do next. Remember that goal we talked about? Every single part of this process is designed to do one thing: empower you, to help you move from that feeling of uncertainty to a place of action with a clear direction and a team ready to help. All right, let's wrap this up by looking ahead and tackling some of those really common questions that pop up for parents who are on this journey. Let's do a quick rapid fire. First up, can it be diagnosed before age 3? Yep, absolutely. Signs often show up between 12 and 30 months. Here's a big one. Will my child need lifelong care? Not necessarily. With the right support, so many people with autism thrive. How about outgrowing it? Well, autism is lifelong, but new skills and strategies can be learned at any age. Is a speech delay always autism? Nope, not at all. But it is one piece of the puzzle to consider. And finally, the big one. What if I don't want a label for my child? I get it. But remember, this isn't about labels. It's about clarity. It's about understanding how to help. When it comes right down to it, getting answers early is what opens the door. It unlocks meaningful support that's built around your child's specific needs and incredible strengths. And that can make all the difference in the world. So I'll just leave you with this thought. What if the next step isn't as big and scary as it feels? What if it's not about getting a label, but just about starting a conversation? Thanks so much for spending this time with me today.